right, so welcome to our final session for the 2022 CCSQ Data Camp. This one is going to be on utilizing qualitative analysis. So for those who are just joining us, please put your questions in the chat. We will answer them later during the Q&A portion of the session. So at this point, I'm going to hand it over to Kathy, who's going to be our speaker for today. Now to you, Kathy.
Thanks, Rachel. Hi, everybody. Thank you so much for coming to the session. I know it's been a long day. My name is Kathy Vu. I'm a social scientist working within iQuick. Next slide, please. So here is today's overall agenda. I'll first provide a brief interview to qualitative methods. This presentation today is meant to be very introductory and hopefully inspire you to look more closely into these methods. I'll then provide an example of the utility of qualitative methods, then finish off with some future directions as well. This session learning objectives map directly onto the agenda that we just saw, walking away from today's session. Hopefully you will learn more about various qualitative methodologies that you can employ with your own work. You will also learn and see an example in the HQuick setting. And last, hopefully you walk away with some points to discuss ways to integrate qualitative methods into your own work with your team. So let's start off our introduction to qualitative methods section. In this section, I'll provide some background, research designs that you can use with qualitative methods, ways to sample, what data collection looks like, and finish with analysis and interpretation of qualitative findings. If you do end up being interested, if you can go back to the previous slide, please, in learning more about qualitative methods, I included 2 really helpful references at the bottom of the slide that I still refer to this day. Next slide, please. Thank you. So in general, when we think about quantitative methods, the main goal is to summarize, make generalizations about phenomena, identify predictors of phenomena, and provide causal explanations between variables. In contrast, qualitative methods are generally used to contextualize phenomena, specifically providing additional information about what's happening. It's also used to understand perspectives of those involved, specifically understanding the key stakeholders. In addition, qualitative methods can be used to provide interpretations. So traditionally, it's argued that quantitative approaches start with theories and hypotheses, and these theories are then tested. In contrast, qualitative approaches generate these theories and hypotheses. Next slide, please. Oftentimes, qualitative and quantitative methods are pitted against each other. However, when we take a closer look at the actual research methods that both qualitative and quantitative methods use, we can see that these methods actually inform each other. In order to get to the theories and the hypotheses that you're trying to test in quantitative methods, you have to be able to first identify the phenomena and generate theories and hypotheses. This is where qualitative approaches come in. Now, if you're interested in generalizing your findings to a larger population, this is where quantitative methods may come in, right? So I am a psychologist and I'm a mixed methodologist, meaning that I use both qualitative and quantitative methods when trying to answer questions that I'm interested in. I like being able to test hypotheses and generalize my findings to a larger population while contextualizing these processes as well. So therefore, I and many other mixed methodologists view qualitative and quantitative methods as complementary to each other. And hopefully I'll be able to convince just one person listening in today. The general research design framework that qualitative researchers take is almost identical to the framework that a quantitative researcher would take. So just starting at the top, you would have your theory and your research question, and this research question informs your sampling methodology. You then conduct your data collection, you would appropriately manage your data and pick the best analysis to analyze your data. And then you would finish off with your description and interpretation, which generates new questions, right? So very similar. In the next few slides, we are going to take a closer look at each of these boxes, specifically sampling, data collection, analysis, and description, and see where qualitative methods really shine. Next slide, please. So no surprises on this slide, selection and sampling strategies for qualitative methods is really similar to quantitative methods as well. For example, we have the typical case sampling where you would identify and include the average or typical person. We also have extreme and deviant case sampling where you would include individuals that quote unquote stand out for any reasons. You can also use snowballing sampling, where participants are asked to identify other potential subjects. And then we also have convenient sampling, where participants are more accessible and thus convenient to recruit. I'm going to be referring to participants and people a lot simply because my training is as a psychologist, and so I worked with people. But of course, you can replace participants with subjects. So we can use any of these sampling methods, but in general, qualitative researchers are very purposeful in selecting their participants. Usually, we would try to recruit information-rich cases to achieve that depth. So qualitative methods, it's very intensive. And so we want to identify a few participants that would give us the most information that we are looking for. That being said, the sample size that you pick really depends on the research question that you have, and it must include an explicit rationale. I can't tell you in today's presentation what your sample size should be, but if you're looking for, and aiming for breadth, then consider a larger sample size. If you're aiming for a more in-depth exploration of certain phenomena, maybe consider a smaller sample size with more information-rich cases. Next slide, please. So data collection is where qualitative and quantitative methods might differ a little bit more. We can use observations to collect qualitative data. These observations can be structured or unstructured. So if you're looking for and interested in using a structured observation, maybe consider giving your participants or your subject a task to complete. So for example, in the past, what I've done is asked moms to teach their child how to fold origami, for example. Unstructured observation may include just following the participant around in their everyday life. In the past, we've just done a free play observation where we examined how mothers and children interacted with each other without giving them a task. So that would be unstructured observation. You can also decide whether you want to do a recording of these observation or a live observation. The pro of recording is that you can always go back and rewatch the recording and see if there's anything you missed in your live coding of the observation. However, the downside is that participants might, of course, change their behavior because they know that they're being recorded. So that's you just have to weigh the pros and cons. We can also do interviews to collect qualitative data. We have structured and unstructured interviews. So interviews can be standardized as well because you have a structured set of questions that you want to ask your participants, your subjects. There are also interviews where you're aiming to understand the participant's life history, and this is often described as a biography. We can also conduct individual or focus group interviews. So depending on whether you want depth or breadth, right? Surveys and questionnaires can also be used to interview participants as well. The last one is something that people sometimes forget, but you can also use materials such as documents and then cultural products, including physical artifacts, music, art, and dance. Next slide, please. So on this slide, I listed a few analyses that are most commonly used. A thematic analysis is the most common analysis where the analyst would identify patterns or themes within the data. A content analysis is really similar to thematic analysis, but after identifying the themes, they're quantified. And so you have that both quant section where you're quantifying the data, but then you're also using the text to contextualize what's going on. There's also narrative analysis, which focuses on the structure, the content, and the function of participants' stories. We also have discourse analysis, which explores the use of language and communication. So something that might be relevant to everyone here is like you can analyze how a doctor might communicate with a patient and that discourse style that they have. And last but not least is grounded theory. And I included a little asterisk there. I included grounded theory in analysis, but it's really actually ingrained throughout the entire research project if you choose this method. So thinking back a few slides where we had that framework up, right? It begins with a very general question, and then through the process of collecting your data and analyzing your data, the question, the data collection, and analysis itself will change and evolve. So for example, if you have a participant, you interview that participant with your first general questions, but then you go back and you analyze that one participant's data, you analyze how you were asking them questions, the data collection method, and then you would change those methods so that when you go and interview your next participant, it evolves a little bit more. So today I mentioned those analyses extremely briefly, so I really encourage anyone interested to take a look at those analyses more closely to identify the analyses that you might be most interested in. So in this section, we will review an example of thematic analysis. Next slide, please. So the overall goal of this analysis was to identify and understand HQuIC work in health disparities. The research question was, what are HQuIC efforts towards reducing disparities and advancing health equity? Sampling and data collection included 9 HQuIC annual reports, and the sections that I focused on were about 5 to 9 pages of text. The analysis was a thematic analysis of the narrative reports. Themes were identified both within and across HQuICs. Next slide, please. So what did I do? I first went through and I read each report without coding. This process is just to get a general idea about what HQuICs were doing, just so that there are no surprises when I actually go in and do my next level coding. Next, I went into each report and I reread each report. And then while rereading each report, I would line by line provide short codes for each of the lines and within each of the reports. After providing the short codes for each of the reports, I pulled all of the codes across all of the reports, so across all of the HQuICs. I generated themes amongst the codes. Specifically, I was looking for any patterns that might come up, and I also identified any sub-themes within the patterns themselves. After this process, I revisited each report and determined whether the themes identified represent the data well or not. If they did not, then I made sure to modify, to add, and or remove any codes as necessary. So I just went through all of the 9 HQuICs and reviewed the codes for each one. Next slide, please. So in these two de-identified screenshots, I wanted to highlight the coding process. I didn't use any coding software because I didn't have access to it at the time, but you can definitely use it. I think NVivo and Atlas are two of the ones that come to mind, but I'm sure that there's other ones as well. Quick Google search will 100% help you there. And I just used Word and Excel to code and organize these themes. So if your organization doesn't have access to NVivo, you can just do it the way that I did it, old school. So overall, we can see that each line is coded for. One caveat is that these screenshots came after themes were modified, so it might seem a little nonsensical, these screenshots, but this is overall what the structure should kind of look like. Next slide, please. So after the modification of themes, I defined the final set of themes. Remember, I went back and I modified, I added and removed, then I defined them, and these are the final sets of themes that I have. Then I interpreted the themes and generated the report. So the next few slides are from a presentation report. I won't go too much into detail, but please do take note of the overall themes and the structure itself. Okay. So barriers and obstacles was the first major theme identified in these reports. There were sub-themes as well. The first sub-theme was barriers in defining and identifying disparities. Within this sub-theme, I identified examples where HQuICs reported difficulties in defining other and race. a lack of diverse populations, and struggling with identifying disparities. The other sub-themes included staffing issues, leadership buy-in and competing priorities, and data-related issues. Each of these sub-themes have examples from text. So for example, staffing issues included staffing shortages due to COVID-19, lack of staff competency in assessing or staging injuries in people of color, staff lacking knowledge, skill, or capacity to stratify and identify disparities. Then for leadership buy-in and competing priorities, the one example that I found was leadership prioritization of COVID-19 vaccinations and patient safety over health equity. And then for data-related issues, we identified incomplete or missing data leading to a lack of observed health disparities in harm areas, limited resources for hospitals to standardize systems to collect health equity data, and formative interventions needing more time to be fully deployed. Next slide, please. The next major theme centered around the action of identifying the disparities. So what are HQICs doing to identify these health disparities? So when identifying the disparities, HQICs reported conducting assessments and analyses to identify health disparities, specifically conducting community health needs assessments, environmental scans, examining public data using real profiles, gap analyses, and HEOA assessments. They also reported working with hospitals to identify hospital-level disparities. For example, they utilized the Patient and Family Advisory Council to help identify main disparities in resources in the community, identified hospitals that were successfully and unsuccessfully collecting and using data related to health equity, and identified quality improvement opportunities for specific hospitals. HQICs also reported generating reports for hospitals that identify health disparities, such as reporting level of social determinant of health data collection and the extent to which hospitals use health equity data to identify gaps in care and set goals for improvement. And last, they reported using available resources and tools to highlight disparities with hospitals, such as leveraging data, dashboards, strategy plans, impact statements, and partners. Next slide, please. So what were the disparities the HQICs identified? They identified race, ethnicity, and language, social determinants of health, Medicare eligibility reasons, patient age, patient gender, and location of patient in hospitals. I don't go into detail on this slide, but there are specific examples of the disparities that they did identify within each of the circles that are presented here on the screen. Next slide, please. So on this slide and the next slide, we talk about the data theme. So in this one, it's a bit more general, but the next slide is going to have a more specific example. Let's go over the more general one here. So data was a theme, and they discussed data frequently in their reports, specifically ways that they can improve the data collection process, identifying new data sources that they can use, identifying new data analyses that they can use to help them identify any disparities and to track these disparities when they're implementing their interventions. And then also any preliminary results that they have been exploring as well. Next slide, please. So here is an example, a very specific example of a sub-theme within the data theme. This is with race, ethnicity, and language data. So in this slide, I provide a mapping of each specific domain, specifically within that data. And for each of these themes, the examples were drawn directly from the text itself. So for improving data collection process, they reported using real data collection toolkits, and then also providing e-learning modules to increase staff education on real data collection. For data sources, they discussed constructing real data profiles for patients when they're working with hospitals. And then they also cross-referenced this real data with external databases, including the minority population profile and the social vulnerability index. For data analysis, they reported the stratification of health outcomes by real data. So some of the outcomes are listed here. So for example, patient grievances, rates, readmissions, pressure injuries, opioid prescriptions, opioid adverse drug events, pressure ulcers, VTE, etc. The last one are just some preliminary results that they had found with real data. So for example, they found that overall, they were reporting that people of color were at high risk for negative health outcomes, including all-cause harms, readmissions, opioid-related ADEs, sepsis mortality, and pressure ulcer. Next slide, please. So HQICS also reported various engagement and interventions. These are listed here on the screen. So HQICS reported providing trainings and education related to different areas of health equity. Education on health equity topics included race, age, health equity exercises and activities, accountable health communities models, and conditional risk and social risk factors. HQICS also provided data related to education and training, including data analysis and how to utilize real data and the importance of viewing data through a health equity lens. When supporting and engaging with hospitals, so this is number 2, HQICS reported the importance of providing tools and resources. So for example, providing modules on building health equity culture in the hospital, using patient screening tools, community intervention tools, and the HQIC portal encounters as well. They also emphasized the importance of ensuring tools and resources provided are translated into different languages. For number 3, HQICS emphasized the importance of providing tailored support to hospitals. Specifically, they reported the need to target hospitals that were experiencing health disparities and provided these hospitals with tailored coaching, some tailored resources, tools, evidence-based practices, and interventions. HQICS hosted events for hospitals on health equity and disparities as well. These events included learning and action network events, workshops on how to use toolkits and tools, summits, webinars, sprints, forums, community meetings for hospitals to share stories and collaborate. For number 5, HQICS provided coaching advice to hospitals on topics related to health disparities. So some of these coaching topics included where and how to identify health disparities and administering interventions and assessments. For number 6, HQICS reported providing hospitals assistance in conducting analyses. So they helped hospitals utilizing data analysis software, exploring ways to analyze data, and conducting different types of assessments as well. For number 7, HQICS consulted with subject matter experts on issues related to health equity. So SMEs were asked to provide guidance to hospitals at events, forums, and webinars hosted by HQICS. One event highlighted SMEs' research on how to use the Area Deprivation Index. In number 8, HQICS reported engaging patients and patients' communities in order to leverage patient voice and involvement. This type of engagement allowed HQICS to provide technical assistance at the state, regional, local, and individual hospital level just to better serve their patients. So some examples of patient and community engagement included collaborative learning and innovation complex workshops, and encouraging hospitals to include community representatives such as church leaders, strengthening partnerships with community resources to assist in post-acute services, and implementing local initiatives. So on these themes, you will see some overlap between them, but I thought that they were different enough for me to break it up into 8. I'm sure that, another analysis of this might review some further, areas that we can move these themes around a little bit. Next slide, please. So for future directions, the HQICS also discussed various future directions with their work, including conducting new analyses, focusing on community-based directions, developing tools, and continuing to identify and provide assistance to hospitals. Next slide, please. So, what was the impact of this analysis? The results of this qualitative analysis led to the development of a standardized data collection tool for quantitative analysis. The findings directly informed what information needed to be captured in this quantitative tool. In the future, the quantitative analyses will definitely inform us and how we can better modify the year-end reports so that we are better capturing the different things that HQuics are doing with their hospitals. Interpretation of the qualitative and quantitative data will be complementary. Next slide, please. Again, I just wanted to highlight this process where we saw qualitative methods informing quantitative methods and vice versa. So it's just complementary, and it was good to be able to see this play out basically in person. Next slide. So I want to finish off with some general comments about the data and the analyses that we use. There is a misconception that quantitative methods are more objective than qualitative methods. However, both quantitative methods and qualitative methods are subject to biases. We're all humans, and we're the ones who are running these analyses and creating this methodology and measurements, right? So just keeping our biases in check. I would also like to emphasize the importance of understanding qualitative methods better so that we can adhere and require more rigorous practice of qualitative approaches. Simply reading a passage or chunk of text once does not mean that you conducted a qualitative assessment. There needs to be some type of rigor that is associated with it. And I would also really like to encourage everyone to create culture of collaboration, where both qualitative and quantitative work is complementary. On our data team within DQIMT, Shiva Aloysius, Jeffrey Behrman, and Damon Everhart, we've created this awesome culture where we're always bouncing ideas off of each other and conducting our analyses with each other. And so this culture is great, and the work processes flow very well, and we're very complementary to each other in our work. So with that, thank you so much for listening. I know I did finish early, but it has been a long day. I would be happy to answer any questions that you may have at this time.
Great. Thank you, Kathy. So yes, we do have a number of questions here for you. The first one asked, have you used textual analysis like that discussed in the previous session for FAS in your quantitative analysis? If so, what advantages or disadvantages have you noticed in its use?
So I haven't used textual analysis before, or at least I was watching the previous presentation. I haven't done that yet. I am very interested in doing a study with NLP and with qualitative analysis just to see what the similarities and the differences are. But I think that in the end, like you still eventually need a person to, like the previous speaker mentioned, you still need somebody to go through and read all these things. So maybe qualitative methods in this situation can help bolster that person's skill in analyzing the text that needed to be analyzed. Does that make sense?
Yes, thank you, Kathy.
Okay.
Yeah, the next question is kind of related to that one. Did you identify your themes before or after analysis? I ask because sometimes people have predefined themes prior to analysis, while others wait until analysis to do so. If upon review of the data, do you think that a text analysis program like FAS would provide benefit and increased accuracy to your analysis?
That's a really great question. Thanks, Christina. I came in pretty much brand new. And so when I was asked that question, I was looking around, I couldn't find anybody who would give me like a list of things that HQuics are doing. So I went into it without any themes in mind. And that's why I chose to use thematic analysis, where I was reading line by line and identifying those themes as they come up. I did eventually, after coming up with those themes, consult with some clinical members in our team just to make sure that I'm on track and that I'm not coming up with themes that might not reflect the data very well. So I came in without any predefined themes, but I do know that there's people who do that, and I agree with you.
Great. So next question for you. How generalizable is the example assessment in qualitative assessments? If not generalizable, what is a typical use other than to guide future quantitative research that is generalizable?
So it's not that qualitative assessments aren't generalizable. It's because our sample sizes are a bit smaller, and so it's difficult for us to be like, hey, this generalizes to everybody, right? But it does provide a lot of context in terms of the processes that are occurring. So this question is like, it's a perfect example of why you would want to use both qualitative and quantitative methods together so that you can get that generalizability, and then you can fall back on the text, on the narratives to say like, hey, this is the process that's happening, and these are the details that are, underlying that process.
Great, thank you. So next question, what is an example of a tailored support?
So there were times where let me see, what they would do is like they would hold like one-on-one meetings with the hospitals and identify, for example, if they have a certain disparity in a certain area, they would provide very specific tools that would be very useful for that hospital. So that's an example of a tailored support.
Great. So next question, have you seen policy decisions made on non-generalizable research results? If so, were they emergency decisions?
I don't think I've been here long enough to answer this question, so I will say I do not know.
Okay, no problem. No problem. All right, next question. Were there any descriptive statistics provided to help support the qualitative findings?
So I used the thematic analysis, and so I didn't quantify anything. If I were to choose like a content analysis, then I could add up all the different themes. Maybe that's the next step in this analysis, to then turn it into something quantifiable. And then we are collecting additional quantitative data as well, help provide some additional support for this qualitative findings.
Wonderful. So next question, were you able to include tabular quantitative data included in the report in your qualitative analysis?
I was not able to because this was mainly exploratory, and I again went into this without any themes in mind. We didn't have any way of tracking that data before this qualitative analysis, and so eventually we moved towards developing that quantitative tool to collect data on interventions and health equity interventions that HQuICs were conducting. So in the future, we'll be able to provide some quantitative data to supplement or to complement this qualitative analysis. And of course, we'll conduct another qualitative analysis as well.
Great. Thank you so much, Kathy. I think that concludes the session for today. I am seeing in the chat, a lot of people just loved your presentation, Kathy. So thank you for coming and sharing that with us. At this point, I'm going to hand it over to Ken Howard regarding our closing statements for this data camp. I can't believe we're at the very end. Ken, I'll hand it over to you for some closing thoughts.
So first and foremost, I want to thank all the speakers from today. Excellent job, and I appreciate your participation. Kathy, that was wonderful. Thank you. To all the participants from the past couple of days, we've been holding some pretty high numbers for these sessions, and I really appreciate your attendance. And I want to reiterate something I opened with, is we look for your feedback about these data camps. Again, both in the content, what are you looking for? Do you want to see more analytic types, more analytic functions that we're doing around here? You want to hear more on the technology that we're using, the directions that we're talking about going technologically or procedurally, how we can support different communities? Any and all of this feedback, we would be really encouraged to hear from everyone. If any one-on-one questions want to be discussed, by all means, send it to the contact information for this session. We'll arrange for smaller team discussions on your questions. We can get the right experts to discuss any specific inquiries. But ultimately, I'm going to give you some time back. I want to thank everybody again for all the participation, and have a great evening. And if you're making a long weekend, great Thanksgiving week coming up. So thank you again.
Thank you, Ken. And you mentioned feedback, and I just want to let everyone know that we are going to be releasing a survey on Monday via email as well as Slack. So if you have thoughts or comments from the past 2 days of data camp, feel free to fill out that survey. We'd love to gather your feedback. All right, so at this point, I think that concludes our data camp. Thanks again, everyone and the presenters, and I hope you have just a wonderful afternoon. All of the meeting materials, recordings, they'll all be available out on Confluence within the next couple of business days. So thanks, everyone.
Hey, Rachel, there was a last minute comment there about where to send any comments to. Is there a specific email address?
Sure, let me just put that in the chat really quick. All right, so if you send those comments there, we'd be able to gather them through that email. But again, we are releasing that survey and it will have a fill in the blanks section as well. So if you have any thoughts that you want to share specifically, we'll be able to gather that through that method. All right, thanks everyone, appreciate it.